Nutrition in medical education has become a hot-button issue, with RFK Jr. making a bold call for all medical schools to incorporate it thoroughly into their training. But here's where it gets controversial. Some medical programs insist they've already been teaching nutrition for years, raising questions about how much more really needs to be done. Recently, the U.S. Department of Health and Human Services, HHS, issued a firm directive demanding that medical education institutions integrate nutrition education into their courses. They even set a tight 2-week deadline for organizations responsible for medical training standards to develop plans that would ensure nutrition appears in licensing exams and residency requirements. This move reflects a growing awareness of nutrition's impact on health, but also sparked debate about the current state of medical education. Two local medical schools, Drexel University College of Medicine in Philadelphia and Cooper Medical School at Rowan University in New Jersey, emphasize that they have long considered nutrition a core element of their curriculum. For instance, Drexel's nutrition program dates back to the late 1990s, according to Michael White, Professor Emeritus of Pharmacology and Physiology at Drexel. Their students receive around 20 hours of instruction covering essential topics like vitamin functions, reading and understanding food labels, and evaluating patients' nutritional needs during hospital care. White points out that because of their extensive nutrition training, Drexel is well prepared to meet the new federal expectations. Given how much nutrition we already cover, we don't have much to worry about with that declaration from HHS and the Department of Education, he says. This highlights an important distinction. While some schools may struggle to comply suddenly, others have embedded nutrition deeply into their teachings for decades. On the other hand, Cooper Medical School doesn't just integrate nutrition into lectures. They actively engage students in hands-on projects. Sangeeta Phattare, Assistant Dean and Professor of Biomedical Sciences at Rowan, shares that their students get involved with community efforts, such as tending a local garden to grow fresh produce and working with Spanish-speaking residents to decode food labels. They even advise diabetic patients on how to create nutritious meals using affordable, accessible items like dried beans and frozen vegetables, especially important for those without easy access to transportation. Phattare emphasizes a profound commitment beyond academics. As a school, we try to do our part because we believe that Camden is our home. It's not just our workplace. Yet she candidly admits there is always room for improvement. Even though I would say that we fare well, there is always scope for doing more. We personally, as a medical education community, think that nutrition in medical education is important, and even without anybody telling us that, we should be doing that. The federal initiative, announced in late August by the HHS and the Department of Education, urges a swift, comprehensive adoption of nutrition training across all U.S. medical schools. U.S. Health Secretary Robert F. Kennedy Jr. likened this call to the rapid shift to telehealth services at the onset of the COVID-19 pandemic in 2020, a monumental change delivered under tight timelines. Kennedy's editorial underscores the urgency. Research revealed that most medical schools hadn't required formal nutrition training, and many physicians felt uncomfortable discussing nutrition with patients. Paul Wishmeyer, an anesthesiology and surgery professor at Duke University, described the situation as a crisis in medical education. Despite concerns about the availability of nutrition experts to meet this sudden demand, Wishmeyer expressed excitement about the new focus on nutrition, calling it an exciting opportunity, one that I've perhaps waited my whole career to see. However, this push for increased nutrition education isn't without nuance. Data from the Association of American Medical Colleges from August this year show that every medical school already includes some form of nutrition education. This suggests the issue might be more about the depth and quality of that education rather than its mere presence. Similarly, in osteopathic medical education, nutrition is recognized as vital, says Robert Kane, president of the American Association of Colleges of Osteopathic Medicine. While not new to osteopathic education, this moment offers an important opportunity to re-engage and enhance efforts already underway, he notes. This highlights a broader trend across different medical education paths to re-examine and strengthen nutrition teaching. In response to the federal directive, the HHS press secretary confirmed that medical schools nationwide have begun committing to improvements, with all relevant accreditation organizations submitting plans. So here's the provocative question. If many medical schools have been teaching nutrition all along, is this federal push about raising standards, improving quality, or something else entirely? Are current nutrition lessons truly preparing doctors to integrate diet and lifestyle effectively into patient care? And what might be the implications for the future of medical practice? What do you think? Should medical schools ramp up nutrition education even more, or worry more about how it's currently taught? Join the conversation and share your thoughts in the comments below.